folks who are just joining us, whether in the room or online, who weren't here for the first hour, you'll see on the table there's a handout that has a bunch of questions written on it. And in the first session, the panelists addressed the first 4 questions. And so we're not going to go back over those because the slides will be available to you afterwards. However, if you want to ask a question of clarification on one of the topics from the first hour, then you're welcome to do that. So here's how it's going to work. For those of you in the room, if you have a question, just put up your hand and I'm going to come to you with a microphone and I'm going to work both sides of the room. I've got 2 mics and I'm going to ask you to ask your question in the mic because then that allows the people participating in the webinar to hear the question, okay? And then Cameron is going to be working the questions for the folks online. Do you want to describe how that's going to work, Cameron?
For the individuals online, we have 2 options. You can either type the question into the chat if it's just a short question, but if you're wanting to more elaborate it and you have a mic on your computer, just to either raise your hand or make a note in the chat and I will put you live so you'll be speaking to the audience in Ottawa here.
Thank you. And so the panelists have asked me to let you know that, so they covered topics 1 through 4 on the sheet that's in front of you. And they did prepare slides for questions 5 through 12. So if there's one of those that's like a real burning question for you and you want to get into like the details of it, they could flip to those slides and speak to them in this session if you'd like. Or alternatively, we can just have a conversation. So I'm going to open the floor and I'm going to turn the mic over to you guys and see who has a question. Oh, there must be someone. Oh, good. Okay. So I'm going to bring you the mic and good on you.
So my question is to do with the tattoo machines. Last year when I was in one place, I was basically asking, they were setting up, so I was saying, okay, well, you need to have this, you need to have that, and then I was asking about the machine and how they have to have it covered. So the operators were telling me, well, these ones are newer, they don't need to be, and they were pretty much telling me they dismantle the whole thing and then pretty much cover it with paper towels and spray it down with sanitizer. So have you seen those types of machines where they don't need to and they can just completely dismantle it and that's okay?
You're referring to rotary tattoo machines, and essentially they are not like the coil ones. The coil ones cannot be disinfected or sterilized. That's why they use the tattoo machine cover bags for them. With a rotary, it can be dismantled and disinfected, but it has to be disinfected properly. Spraying with alcohol is not really going to do it. You need to clean, rinse, dry, soak. Now, the idea is that with all my operators who use rotaries, they are not going to take it apart after every client, so they just continue to use the tattoo machine bags, and that's what I would suggest. If they're willing to take it apart completely and do the cleaning and disinfection, then they're perfectly welcome to go ahead and do so. And that would still be compliant as well, but it's going to be a lot easier with the machine bags.
Jason or Brenda, do you have anything to add to
that? Yeah, well, only that we're not, in Alberta, we don't, you don't have to do that, cover your machine. Even the old machines that were really hard to clean. I don't love that, but we've kind of left it optional. I look at the tattoo assembly, kind of like holding this pen. What you're describing is kind of going on up here. I'm a lot more worried about that clip cord that could touch bare skin or exposed skin. If you think about a big tattoo on someone's back or something, that's going to touch their skin, and I'm really interested in that getting covered. This one, I remain to be convinced, that there's this like spray going up in there. Do I think there's some? Maybe, but is it like is there a transmission of disease risk? It's certainly less than, what's going on down at the business end. And the tube and the grip, and this cord are kind of mean more to me. So we kind of choose to kind of zero in here and then work our way back from there. Maybe another way to look at it. Depends on what your province requires too.
Anything else to add to that?
I think my only other point is really just if you're ever in doubt, you're in the field, and this is basically what we all do, right? You're in the field and you just don't know. Bring it back, we'll research it, do a total research on the thing and just see whether or not that process seems to meet the requirements of, so the exposure, like what type of exposure did that piece of implement actually have? And so what type of reprocessing does it need? So go that route and then try to figure out if, whether they want to take it all apart or put on the bag, like Christian said, so that you can move on to your next client faster, right?
So for those of you who want to ask questions, just put your hands up while they're talking. I'm keeping track and I will come and bring the mic to you. It's kind of like a first come, first serve. So we've got 2 people on the other side. I'll let you ask yours.
I have a couple questions, but I'll just go with one first. You were talking about having more mobile vendors, so to speak. How do you get in touch with them, for example? And yeah.
So you're referring to an established business that is mobile, or?
No, they're just mobile in general. So, for example, I had an operator who said to me on the phone that she was mobile and she only does mobile, but then she was unresponsive to any other phone calls. How does, without, I guess, setting up an appointment, how do you get in touch with them?
Well, what I do with mobile operators is I could meet them anywhere, and it usually ends up being their home. And I just tell them, okay, let's see you set up like you're going to do the service. And it's like the same thing for conventions or things like that as well. It's, what applies in the shop applies on the road as well. So with my mobile operators, they usually have their, the biggest thing is how they store things and travel with them. And of course, you need to travel with sometimes some dangerous items like sharps containers or chemical liquids or things like that. I always try to negotiate with them to get them to use as many disposable things as possible. But I would say the best way to set up with a mobile operator is to either meet them at their home and do it, or if it's accepted by the person that they're going to do the service with, that you could meet them there. But the home is usually how I've been doing it all these years.
I would just add, and it was part of one of my slides that talked about a growing trend of that, and it's mobile tattooing, mobile piercing, mobile aesthetics. Basically, anytime you go to Costco in the parking lot, there's a mobile somebody or other, and it's all kinds of personal services. So I think what you might really be asking about is, should they have to call us first to get approved? And we don't have that requirement in Alberta. The discussion about like pre-registration or permitting, it sounds like maybe some of the municipalities in Ontario have led the way. So like to get your business license, you must contact a health department. So that's certainly been identified nationally as an issue, that pre-registration, or you can't offer the service until the health inspector has checked you out. But we don't have that. So again, like my initial point was, like Christian said, what applies on the road applies to the commercial setting you're in. So the same rules apply. So I just have to trust that operator knows that the health standards and guidelines for aesthetics apply to them. But if right, neither do we. Mm-hmm. Yeah.
And that's where we're getting, especially mobile ones. If I can go to their home, I know that they're there. But mobile ones, they're never there.
Hard to find them. Yeah, for sure.
Brenda, are you going to add to that?
Yeah, so the only other thing that I can add is sometimes, yes, going to the home would be ideal, unless they don't actually live in your jurisdiction. So if they don't, because they're mobile, right? So what if they, I'm in Durham region, but they actually live in York region. So I would call up York region and say, hey, do you know about this operator? Have you inspected them? So if they say, yes, we know about them and they're fine, then we just let them operate in Durham and it's whatever. The other option is if you've got a telephone number or anything else, you got nothing else, just the telephone number? Okay. Name and phone number. Sometimes online, like, I mean, if you tried Facebook, if you try and like Google it and just see if anything, you can hit anything, sometimes that might help. And sometimes you might want to do a little bit of sneaky type of inspections. Yeah. So you just make an appointment.
So that is something that is, I wanted to know that because it's not something that I've done before, and that would be a way to do it. But
Hi, I'd like to, give them a call. Hi, I'd like to check out your service. Can you come see me at such and such a place or whatever, and set it up that way? Right? I mean, that's just at least just to get them to meet you. Well, you're not charging them for anything. You're just making contact. Right? Yeah. Right. I'm just confirming you have a business. Right? And if they come and meet you and they've got their stuff, then they're running a business. Right?
So we have a question at the back, and so for the questioners, if you want to add to your question, just let me know so I can bring the mic to you so that the people who are following on the webinar can hear. Otherwise, it's just kind of like dead space. They can't hear us just talking in the room unless we have a mic. So at the back.
Hi, my question is in line with point number 8 on the handout, and I just want some information as to what what's considered as disposable item, and in what cases can disposable items be reused, if at all, as well as, what about reusing items on the same client. So, for example, having a little bag with little tools that they reuse over and over on the clients that come back for the service. Thanks.
So disposable items.
Just so happens we had a few things prepared for that. Yep.
Okay, so basically with a disposable item is anything, disposable item is anything that cannot be reprocessed, right? So what you're looking at is if it is an absorbent type material, if it's something that just really cannot be cleaned and rinsed and disinfected in a proper way. So that's disposable. What you basically want to, now, and I know we probably differ on this in terms of same client use. We used to do it in Durham Region where we allowed to have the kits, the client-specific kits. But over the years, we've kind of realized that they have now this huge collection of client-specific with everybody's names on them. And then now this is almost becoming a hoarding issue because they've built these, elaborate cabinets and stuff like that. And then you look inside the boxes and it's just filthy in the boxes because they don't clean before they put it back into the box. So now you're creating an occupational health and safety hazard for the worker, because now you're exposing that worker to this person's nail dust or skin or dead skin or whatever. So you just have to be careful of we went the route of, okay, if it's disposable item, no, it's not to be reused. You give it to the client, take it home, and the next time they come in, you give them a new disposable item, right? So that's kind of the route that we've gone with those. I think I've pretty much, and then there are some things out there that's, called sanitizable, like right on some of the files that say sanitizable. Well, that doesn't mean anything. So we call basically all foam core, spongy type, anything that's spongy, we're just saying, no, they're single-use disposable, period. Just give it to the client and away they go. Okay.
Next, this one. Oh, it's Jason.
Okay. It's a good question. I just want to again go back to that, how strong we are in a food establishment versus how weak we kind of are. Sorry, I can say that because I'm a big CIPHI guy, so I can say we need to build our capacity in personal service inspections, and I don't think you would disagree. But in a restaurant, we would never let them take a wooden fork and put it through the, those tiny little ones you scoop ice cream with. We would never let them like reuse those, right? But we kind of allow it in personal service settings. And these things that we were taught, like paper, foam, stone, wood, we know those are porous and they'll harbor germs and sponge and all these other materials. And yet, for whatever reason, whether the fact that they've been chronically under inspected or our legislation isn't strong enough, we see them reusing them. I just want to kind of show what I mean by that. I mean, that is a device that was cleaned, and it kind of still looks dirty to me. What's in the white stuff, that could just be residual disinfectant, but that material, that kind of paperish material, doesn't lend itself to reprocessing. So there are better options. That's solution number one, is we as a collective, as a profession, start to work with the suppliers and say, we need better options in your facilities. And we've seen some success there. Not uncommon to see things like this that say cleanable. I think this one says cleanable. You can see like skin in the word cleanable, which I think is really, really interesting. Yeah, and you can see that these things don't wear well when you do try to wash them. So yeah, you could try to wash a single-use item, but it doesn't play. When you go to the salon supply store, you start to see that they sell better options. So on the left, you've got a barrel of buffing blocks, if you will, whatever it is you pay per unit. They've got those smaller ones now. They only really need that much. So the operator can buy a better option, promote single-use items, that kind of thing. Following manufacturer's instructions is the other sort of IPAC golden rule. So I would say, unless the manufacturer gives you cleaning instructions, it's a single-use item, except when the cleaning instructions are junk. And I don't know if you've ever encountered the dermal roller or its knockoff cousins, but the manufacturer's instructions for this one, basically after you've used this device with 200 needles on it, just use medical alcohol to disinfect parts need cared and the microneedle. Very clear, very, very common sense instructions. That was a joke. Well, the instructions are a joke. But anyway, so there's this part about single-use items isn't just nail files and things like that. It's these other things that we're bombarded with that we really have to use our skills to determine. Uncleanable, we can take that discussion a bit further and go, why did we ban this kind of piercing gun? Because it's basically uncleanable. I don't even know if it's a single-use device. I guess it could be, and then you'll see these kinds of things in spas where these tiny little holes just can't be cleaned. It's either not appropriate to use once or it just can't be cleaned.
So, okay, we to avoid the repetition, essentially if it's intended for single use or too dangerous from an occupational health and safety point of view, like sharps, needles, lancets, razors, whatever, that's definitely a single-use item because it's not only dangerous to the operator but dangerous to the client. So sharps can never be reused in any circumstances. And just to expand on the foam and emery board and stuff like that, just all you got to do is think about the nature of the surface. If it's smooth and impervious, it can be cleaned and disinfected and reused. But most of these items, they're not cleanable. So if you can't clean it, then you can't disinfect it, obviously. And here's the example you were talking about, Brenda. Sanitizable? No, there's no way. So ideally, I agree with Durham's approach that disposable is disposable. But the thing is that I'm looking at it more from the point of view of compliance and where the health risk is. So like a lot of governing agencies will tell people, bring your own manicure tools when you go to the spa. And if the clients are bringing their own tools or are supplies with their own tools, whether they take them away with them or leave them on site, it's only being reused on the same person. So therefore, the issue becomes storage. Now, most of my places that use disposable stuff now have it preset like this, where they'll have the disposable item, the client comes in, they give them their own client package with all their own tools, and then they label it accordingly with the client's name. Now, I only allow hard plastic cases for this purpose. because you don't want to be using Ziploc bags or things like that, because things can tear in storage and then you've got a cross-contamination issue. But what I usually do tell them is if they're going to abuse this, like if I go and I find that they're not labeling things properly or there's some used items in an unlabeled box or something like that, then essentially I just revoke the privilege to use the client system, and then that way they have to go disposable. That's the way we do it in Ottawa. And generally this is mainly a big issue for false nail salons. Most of the high-end spas are generally throwing things away.
So we have, just to give you an idea, we have 30 minutes left. So to give you an idea about in terms of how many questions we might be able to fit in and how long the answers can be. So just I'll set that guideline. Sure. So Brenda, one quick comment.
And and of course I've just lost it. After that,
okay.
It'll come back to me.
It'll come back. Okay, so sir, you have a question.
First of all, thank you everybody for sharing your insight and knowledge on this new yet painfully old subject of personal services. In our region, we have a problem with accredited labs or access to them, and so we've actually, to gain compliance, we've gained the cooperation of our hospital sterilizing department for providing spore testing for our few facilities that are doing sterilizing. So your question number 10, are accredited laboratories required for spore testing requirements? I'm just interested to hear your comments on that.
Yeah, I just want to make sure I got the, oops. There, oh, damn it. Sorry.
It's okay.
Well, can I still change it?
Yeah, good.
Okay. All right, sorry about that. The concept of accredited laboratories for incubation of spores used for biological monitoring of autoclaves was to be consistent with other provincial regulations already in place. And it really got amplified after Walkerton, and that's when they started ensuring that accredited laboratories were used for water testing. And when you think about most of our public health functions, it's all accredited labs used for water, food, stools, blood, things like that. So that's why the accredited lab thing came up for personal service settings as well. But we've been looking into it, a small group of us at the ministry, that we've discovered that, from talking to organizations like CALA and the Standards for Canadian Council, so accreditation is voluntary. Now, Ontario labs who perform environmental testing are accredited by the Canadian Association for Laboratory Accreditation, or CALA, or the Standards Council of Canada, SCC, or Institute for Quality Management in Healthcare. Now, accreditation is very expensive, $5,000 a year alone just for the fees. So we've talked to other labs, and the whole point with the other labs is they're saying, well, we can't really afford that because most PSS labs are going to be private labs. Now, for accreditation is defined as formal recognition of the competence of a laboratory to carry out a specific test, and they have to do it in accordance with a certain standard, ISO 17025. ISO 13485 is something we would also be familiar with. For example, when you get sterilization certificates, the ISO standard is usually kind of written down into it, and that's a standard for medical devices. So that's where those international standards come from. But when you're accrediting a lab, even the organizations like CALA and SCC, they may look at your biological monitoring processes, but it's not in the scope of accreditation. It's not a standalone accreditation standard. And incubation of spores used in biological monitoring from an outside party, so you're incubating somebody else's spores, is definitely not something that would be reviewed in that sense. There was a public health lab in Durham Region that applied. They wanted to get accreditation for doing this, and CALA refused them. So presently there are no labs in Ontario that are accredited for this. So I think that because most of your accredited labs are generally hospitals, healthcare, things like that. So we are not going to be seeing accredited labs for this. I think what's going to come from this when we're done is a recommendation. And what we've also been doing is looking at the private labs, and if they can provide you any kind of policy and procedure or quality management system that you can review, not that we should be the ones making that decision, but it's certainly a good starting point to have that policy in place. And another thing with the accredited labs is the ones that are accredited generally use the vial and incubator system as opposed to the paper strips. So they wouldn't even have the ability to incubate their spores. And the thing is, we like to have the PSS as having the paper strips, because then they can mail it off to a third-party system. And then that way they're not incubating their own spores, and that way therefore not possibly abusing or misusing. So with the vial system, you can get the vial and incubator like this, but for most PSS, we always go with the paper spores, where they can run it through the autoclave and then they mail it off to the lab, then the lab incubates it and sends you back your results. So essentially, that's been working well, so I don't think there's ever going to be a need for requiring an accredited lab.
Can I add on to that one?
Pardon? Yeah, make it quick.
You got to hear my take on this, people. Okay, I agree. I mean, accredited lab for me has become kind of a red herring in a way, because it's like this unachievable dream. We in Alberta, we got stuck with the fact that our lab has limited resources, our provincial lab, and traditionally we sent our paper strips to the lab and then they converted it to vials. And meanwhile, they're getting all this biological and chemical, water samples coming in and food samples. So we're putting a lot of stress in our lab to require the one lab in Alberta to do that. So we basically want to, just to cut to the chase, when you monitor sterilization, in my opinion, all of these steps count. Okay, we trust the operator to do every other step of sterilization: physical, chemical, biological monitoring, buying the right autoclave, loading it properly, unloading it, storing it, cleaning it, rinsing it, drying it, visually inspecting it. All of those steps, if you did one of them wrong, sterilization is no good. So spore testing in Alberta, based on the limited needs of the limited resources of the lab, we've actually started to allow on-site spore testing, and they just use a vial. They keep track of it. It looks very similar to physical monitoring of sterilization, where it's load numbers. You've got a test, and you've got a test vial, and you've got a control vial, and you record all of that, and it's very inspectable. It's just going to be on your comfort level with it. But right from the start, spore testing does not equal sterility, and I want to get that point across. It's one of many steps along the way that helps us determine if it happened. So we've kind of just based on need had to embrace this. The other part of that, and I'll turn this over, is just the dental office right next to my tattoo studio spore tests every day. They spore test every day. They run their sterilizer. So in personal services, we've allowed them to do it every 2 weeks or every month, and I'm not sure why that ever happened. It's probably, again, like an operator-friendly decision that we made. But yeah, I'll leave it like that. Thanks.
Thank you. So over to you. You have a question.
I do. I want to continue on the trend and go with question number 6. So we've had flotation tanks kind of brought up as a topic within our health unit, and I just wanted to get your take on it. I know there's going to be a bunch of slides, and it's not in the interest of time, but sorry.
And for the rest of you, if you have a question, put your hand up so I can come to you with the mic. Yep.
That's perfect. Yeah. Okay. I'll start. So float tanks, I was just in Portland. They have like a North American float tank conference, and I went down there and hosted a session with a bunch of float tank builders and operators about what they're telling us. And what they're telling us is, you guys don't know what you're doing. Like, I go to this city and they want one thing, I go to this city, they want another, I go to this state, I go to this province. So there's this resurgence across North America, and we're very unaligned in our approach to flotation tanks, and hence the question coming to Christian, number 6 on our list, right? Recognize that this is not just a phenomenon for community level service. This is also really taking off in 2 other areas. One is professional sports. You can imagine like the investment that pro sports teams put in their players. Float tanks are going to start showing up in sport and university sport facilities for sport performance purposes. And you have to decide, is that a public health facility or not. The other part of it is for the mental and physical benefits of flotation. That volume of data is growing. So my next point is this a personal service? I think when we talked about restricted activities or controlled acts, I think we don't really have a definition of personal services in Canada. We have an idea of what they feel like or what they are sometimes. Like certainly tattooing is one, but is flotation one? And I'm not sure. What I've come to realize is I want to embrace this idea of health services. Do we need to regulate health services? There's lots of unregulated health services right now. So I see flotation as a health service because there's no aesthetic or cosmetic benefit to it. It's only for health reasons. There's a big volume of data that says it's very helpful to people, day-to-day lives, but also like with mental trauma and things like that. So this is a scenario, unlike tattooing, there's nothing to weigh the health benefits of tattooing versus the potential risks, right? But with flotation there is. And that's why I think we need to paint all health services with the same brush we paint personal services with. Yeah, and I'll just leave it like that. I mean, I come from a swimming pool background, but I would never apply the swimming pool legislation. There's a lot of good reasons why, and you'll get these slides, so I'm not going to hit through them, but why flotation isn't swimming. And the number one reason is the routes of entry. You're not going to ingest, if you've ever floated, you know you can't get that water in your eyes or mouth, or else you have to get out. Your eyes will sting, and you have to shower. If you get in your mouth, same thing. You're not going to be able to lay there comfortably. You have to get out. Earplugs, so there's no water going in. The routes of entry are much different, so it's a little bit frustrating across North America for operators when we apply swimming pool legislation to it. Because if you think about the rationale behind requiring a residual disinfectant in a swimming pool, it's because you're going to drink that water. You're not going to do that in floating. And that's the number one difference. There's a bunch of other ones. Just check out the slides later. Might help with that. Yeah.
Okay. Are you guys going to add to that, or will I turn it over to the next question? Yeah? Okay. To you.
My question is number 12, actually. Should double dipping be permitted in chemical-free nail polish?
I think that one is Jason starts.
Okay, well, I'll go first. No. Sorry. My point is, you lost me at double dipping. I mean, this is the way the question is. I get where the question's coming from, but I'll never condone double dipping. So should we double dip ever? And I just can't say yes to that. And I get there's the chemical nail polish and ones without chemicals, and will germs grow in there? But I don't even want to test it because I don't want to get to the point where we're saying, yeah, it's okay to double dip. That's really my point. The other point I was going to make was there's these aesthetic salons, and we did it in Alberta, in this province between Saskatchewan and BC. They did this study of uninspected salons and found very poor compliance with the legislation. And I'm thinking if we're at the point where nail polish is our biggest issue in that salon, then that's great. We're almost at the finish line. There were so many more issues to come up with. Not to belittle the question, but it's, we do see it and we know it goes on, but we just kind of focus on other things. Yeah.
When it comes to the double dipping, we never allow double dipping in any cosmetic preparation. So why did we ever allow it in nail polish? I think that we kind of were a little slack about that for the reasons that nail polish contained dibutyl phthalate, formaldehyde resin, toluene. So essentially a hostile environment for pathogens. So that's probably why we weren't too concerned about it. But when you think about chemical-free nail polishes, which is where a lot of companies are going now, and I've spoken to OPI and all of them, and they're all going to be eventually doing a lot. At that time. And I had contacted USA nail manufacturers and informed them, listen, can we work with smaller bottles? Or the clients buy their own bottles, et cetera, et cetera. because they do have smaller bottles for promotional events. And we were hoping that they would kind of see the logic, but instead what they did is they sent a pack of lawyers over to Toronto. And next thing you know, I was informed by the Chief Medical Officer of Health, and I was sent a letter that he responded to their lawyers with, saying that they're permitted to double dip in the nail polish, but however, an inspector would be able to issue an order if during the course of an inspection, it is in their opinion that the reuse of a nail brush constitutes a health hazard. So again, kind of putting it back to us. And it kind of hasn't really moved on since then. But Dr. Sitar and I are going to be looking at what kind of things could survive in nail polish. And when we publish the book, we're going to be putting that out there too. So it's certainly something that we're going to look at. But unfortunately, I can't see us being in a position right now to tell people that you can't double dip in the nail polish. I always recommend for them to, I educate them the best I can when it comes to the chemical-free stuff, try to avoid it. And a lot of them, it's gotten better. And a lot of my operators now have, they have their clients buying the product or single use for them only. I had some operators try decanting and using disposable brushes, and it just didn't work. So that's where we are with the nail polish thing now.
Brenda, did you want to add anything to that, or is that covered? Yeah, okay. So over here, you had another question.
Yeah, another question I have is about ear candling. Why are they so easily available for operators to purchase, yet we don't allow them to use them?
What's what ear candling?
Ear candling. Actually, come and see me after. I'll give you a card. And I've got a bunch of information on ear candling from Health Canada and stuff like that. It's not permitted. That's the bottom line. There's been studies. There was episodes on Marketplace, CBC and stuff like that where they looked into it, and there is absolutely no benefit to it at all. And they've listed how many people have actually been injured by it. And there's actually resources on the Health Canada website that explain why it is dangerous. So I just don't let people do it. Are you okay with that? But I'll
No.
come see me after and I'll send you all the info.
No, I understand that it's not allowed, but why are it's so easily be able to find the ear candling, at like the ear candles?
Yeah, it's true. It's a like, because they consider it a medical device, and Health Canada has said that it can't be used. It's banned. But you got to remember, at a federal level, they're not going out there and enforcing things. It always falls to the provinces, and then eventually it lands on your desk, and you have to deal with it. But that often happens with a lot of other things like cosmetic products. Whenever I have to look into something, investigate something for a client, we have to go to the cosmetics division of Health Canada to ask them, which products are allowed in which way. But even if they're using something that is banned, if it's really bad, then they will go and do an investigation. But generally speaking, they don't really follow up with these things. And, as far as the ease of getting them, anybody can, people can get Botox and filler and stuff online. So, everything's out there.
There's just a reminder. I mean, it is buyer beware. I mean, they have to know what they're buying into. Everything is available, like Christian just said. I mean, you go to the spa show and the UV sterilizers are all on sale, and the glass bead sterilizers, they're all on sale. So everything's on sale. It really does go back to the operator and the buyer beware thing.
Any more questions? We have about, I'd say we have time for one more question, like the burning thing, like you've always wanted to know. Like, think about when you're there and you're inspecting and you're like, what do I do with this? Anyone? Aha, good.
And while you're getting that over there, I did figure out what it was that I wanted to talk about, that disposable item thing. It came back to me. So just back to Christian's point about having the client packages. So when we made the decision to move from, yes, you're allowed the client packages, to no, you're not allowed to do the client packages, the operators were actually very, very supportive of that decision, because they were actually sick of actually having to store them. So just an FYI.
Okay, so mine's question 29. So single-use nail files and buffers reuse is a common issue. Obviously, that's not something we can issue an order for immediately. However, if there was a infection, you could. But that's more of a reactive approach. So just getting your comments on that and how you best deal with repeat offenders.
Well, what we've started doing is we've actually put together an ROL, a repeat offender list, and we monitor these places closely. And education is usually very useful, especially during inspection, but we have noticed that there are some facilities, and, why beat around the bush? We're talking about the false nail places, and I'm sure that's what you're referring to. You go, you get them back in compliance, you go back later, and they're out of compliance again, and then it's the same song and dance over and over again. We've done a few other things. Like once you're on that ROL list, then your next move, I let them know if I come in here and I see anything wrong at all next time, we go straight to a section 13 and we close them. That's what I've been doing with them now. With anyone who's on the ROL list, when I go there, if I see a deficiency, they're closed immediately. And they're not allowed to reopen until they're completely compliant. But if it's going to happen again after that, then we go to the summons. So that's how we're dealing with those places. But we're also getting a lot of help from our web disclosure system, because then a lot of people go to see the inspections and they see that if a place is good or bad. So not only are they hearing it from the inspector, they're also hearing it from their clients. And of course, you can also have media releases that go along with those things as well, which also are very helpful. But yeah, definitely when I see that it's you're hitting your head against a wall there with certain places, then we throw lately, I would say within the past year or two, we've been really going heavy on them. We haven't had to go to court yet because they end up complying because they know how serious we are. So we've been pretty lucky with that. But those would be the steps that we would take.
Brenda or Jason, do you have anything to add? And then we have an online question, I think.
Okay, so I would, I think that's why some of the health units have left standing orders or given a pretty long time frame for those orders that stand. Ours is 24 months in Durham. We do that because what you're actually aiming for is behavior change, right? And within a 2-year period, that's what we're hoping, that by 2 years, you got it, right? Except for that one premise that I was talking about earlier, where you just like slap an order after an order after order. And for that one, I'm thinking, I know my team in Durham is probably listening right now, but I'm thinking it's probably for them, maybe we just increase that order to like 3 or 5 years and just leave it, and who knows. But I think that has helped a lot, because you are monitoring them for the 2 years and you have that ability to go back and actually charge them, right? And again, remember the Section 13 orders for us here, it's they have that appeal period at the beginning. But once they pass that appeal period, as soon as they breach anything in that order, you're breaching the section order of the public health inspector. So it's not the issues in the order anymore, you're just breaching the order. Okay, so that's how we've dealt with it.
Jason, do you want to add to that, or?
No.
Okay, all right.
I saw a comment from Halton.
Go ahead. Did you want to, Cameron, did you want to add something?
And this is actually just a statement from Erica. I apologize if I butcher your name. Bontovic? She would like to thank Christian for organizing the panel and tackling the myriad of questions and aspects of the PSS program and of those in the inspection field inspections, informing and educating service providers, thus protecting the health and safety of clients. The Ministry, in collaboration with our colleagues at Public Health Ontario, is committed to assisting the field and look forward to collaborating with the PSS community of Ontario health units to further this issue.
Thank you, Erica.
Okay, one closing comment or statement from the room, and then I'm going to wrap it up. Anyone? Anyone have a final question? Okay, good, good.
I'm sorry, man, you're going to...
I'm just going to bring you the mic so that the other folks can hear it.
So you know how you're talking about the sinks that you've allowed to be operator friendly in Alberta, but then Christian and Brenda were saying, no, you need to have the 2 sinks, right? Do you ever play devil's advocate with yourselves and say, is this really necessary for any of the things you've put forward? I mean, it's just between us, obviously. You have to have the standard for the... But is there anything in your minds that you can think of right now that you just, well, sometimes I debate this, but this is why I still do it?
Yeah, no, I know that sometimes you're there at the inspection and it's like, yeah, I'm sorry, you can't do that. And it's like, is that really a health risk? You know, like the thing is that you can have the same situation in 20 different establishments, but it depends on the operator. And sometimes you're going to get some operators that are always going to do it right, no matter what. And then sometimes you're going to get operators who are always going to do it wrong, no matter what. So that's why you got to kind of stay the course and just say, okay, I'm sorry, but this applies across the board. Now, I will admit sometimes I'll say, okay, well, here's how you can rectify this situation in the interim or whatever, like for a sink, you know. It's like, okay, I actually, it's kind of funny. I just walked out to here yesterday, walked by Avita, who I haven't inspected yet at the Rito Center here, and I walked in and it's like, I don't see a sink anywhere. And she's like, yeah, we don't have one. And I'm like, okay, well, you know, what do you know, they've got disposable makeup applicators, that's good. And I'm like, do you have a situation where you can use a sink? And she goes, yeah, the chocolate place right next door, they let us go there to wash our hands and clean and disinfect our tools. And I'm like, okay, well, I think I'll be coming to see you soon. Because you're going to be installing a sink pretty soon. But, you know, again, in the interim, they could do that. You know, there's no need to close them, right? Because you can tell when people want to play ball, so to speak. But all situations are different.
Note to self, don't buy the chocolates. Okay, so one last question here from this gentleman, and then we'll wrap it up.
Well, my question would be number 5. Whether home-based business should be inspected.
Could you just repeat the question for the...
Number 5, should home-based businesses be inspected? Yeah.
And we'll have to make the answer brief because we're
Sure.
basically at 2 minutes before the end.
This is a quick one.
Yeah, I mean,
Yes.
I'll start. I mean, the answer is yes. Whether you're prepared for it, you have the capacity for it in your area might be the question. There's some of the most detailed investigations you'll do. In my opinion, that's where the risks are, though. I mean, the people that go through all the hard work to open up a commercial space and get sinks in there, they're doing it right. You might have to help them along, but they're doing it right. I mean, we tend to find that home-based businesses are trying to save money to begin with. That's why they're out of their home, and it just kind of goes from there. So, yes, you should be there. This would be my answer, in short.
I'm a yes as well, and basically they're a business, so they should be inspected, in my mind.
Yeah, I agree as well. If you're offering any kind of service, or and one place where I find a lot of locations is Facebook, Groupon, things like that, and we've discovered a lot of home-based businesses that way. And what I tell them is, and I've been lucky. I've never been refused entry in 20-something years of doing this. So maybe there's a little bit of charming that goes on there, or clever ruse to get in. But if you're offering any kind of service to the public, whether you're doing it from your house or a commercial business, I think you should definitely be inspected. Keep in mind that if you've already been there and you've identified a health risk, then you have the ability to be able to get an order if they don't allow you re-entry. So the trick is getting in there at first. Once you're in there, it's okay, because once you've identified any kind of a health risk, then you can also get in there with a court order.